Hello and welcome to this week's Debrief. My name is Natalia Munoz and I'm an occupational therapy student. And this week we're going to talk about some of the challenges that I personally find while working with the pediatric population. I honestly think that one of the most difficult and most challenging things is to have the parents carry over most of the activities that we would perform in the clinic. Sometimes it's understandable they don't have the time. Sometimes it's culture, or they just don't really understand the benefits and the purpose of the activity. And let's say you're trying to teach the child how to undress themselves, which is one of the first things they would do. So you're encouraging the child to learn how to take off their shirt or their socks, but because of time constraints, the mom or the dad will do it for them before bath time. And if you're having them learn how to dress themselves, it's the same situation. If the parent doesn't have enough time to have the child practice, then they're gonna do it for them. So they limit those opportunities for the child to carry over the skills that they are learning in the clinical setting. So what would be some of the strategies that I would use in order to overcome this challenge? Well, I would try to bring in the parent in the session if possible, so that they understand what I'm doing, how I'm teaching the child how to complete the activity. And then I would tell them, like, I know it's really hard to do it every single time, but at least whenever you get the chance, usually before bedtime, when everything is kind of calming down, have your child try to take off their shirt before they take a bath, or have them put on their pajamas, because in the morning they're getting ready to go to school, they're getting ready to go to work, and so it's understandable that time constraints are an issue. I would try to maybe record a video if they allowed, so that they can see what the child is doing and then they can see it at home. So it's like a video modeling of the task that they have to do. And maybe also give them more activities that are not always the same that we're doing at the clinic. Maybe the child can play with a doll, and they can undress the doll, they can practice, and they can play at the same time. So those would be some of the strategies that I would use. Now, another of the questions would be what diagnosis I've heard about and then I would be more interested in treating. And I have to say that I would like to work with children that are visually impaired, because you need to teach them to use their sense and their auditory skills to be able to orient themselves in space, to be able to be independent. So I think that would be a population that I would be very interested in treating, and learning what compensatory techniques they use to be more independent. What is the technology that they have right now to help this community. Now, a diagnosis that I've heard and maybe I wouldn't feel comfortable providing services, I think that maybe working in the NICU with premature babies, I feel like they're very fragile and I'm not prepared right now. Although it's something that I would probably do in the future once I have the training. But knowing that they're so fragile and I don't have the experience to work with them, that would be maybe a population that I'll be a little bit more hesitant to go into right now. Other than that, I think like learning how to help children with different diagnoses, even if it's maintenance, like I've seen patients that they don't make progress because physically they can't anymore. Children with severe CP, or children with neurological conditions that they cannot improve. You still have to provide services so that they can maintain what they have and they don't deteriorate. So I think that that is still something that I would treat. It's more slow pace I've seen, so maybe that would be the second one that I would not treat too comfortable, because I wouldn't know exactly what to do. And that was it for this week. It was an interesting week. It was good to understand what different diagnoses are in the clinical setting and which ones would be more interesting compared to others. Thank you for joining me and have a great day.